Monkeypox was discovered in 1958 when two outbreaks of a pox-like disease occurred in groups of monkeys being used for research. It spread mainly through human contact with infected rodents, but can sometimes be spread through skin-to-skin contact with an infected person. There are two known types of monkeypox virus, one that originated in Central Africa and one that originated in West Africa. The current world outbreak is caused by the less severe West African clade. Monkeypox is a rare disease caused by the monkeypox virus. It leads to rash and flu-like symptoms. Like the better-known virus that causes smallpox, it is a member of the family called orthopox virus. Who does monkeypox affect? Anyone can get monkeypox. In Africa, most cases are among children under 15 years old. Outside of Africa, the disease appears to be more common in men who have sex with men, but there are numerous cases in people who don't fall into that category. How is monkeypox diagnosed? Because monkeypox is rare, your healthcare provider may first suspect other rash illnesses, such as measles or chickenpox. But swollen lymph nodes usually distinguish monkeypox from other poxes. To diagnose monkeypox, your healthcare provider takes a tissue sample from an open sore. Then they send it to a lab for polymerase chain reaction, PCR, testing. You may also need to give a blood sample to check for the monkeypox virus or antibodies your immune system makes to it. Signs and symptoms. Early signs of monkeypox include flu-like symptoms like fever, chills, headache, muscle aches, fatigue and swollen lymph nodes. After a few days, a rash often develops. The rash starts as flat, red bumps, which can be painful. Those bumps turn into blisters, which fill with pus. Eventually, the blisters crust over and fall off. The whole process can last 2 to 4 weeks. You can also get sores in your mouth, vagina or anus. Not everyone with monkeypox develops all of the symptoms. In fact, in the current outbreak, many cases aren't following the usual pattern of symptoms. This atypical presentation includes only a few lesions, no swollen lymph nodes, less fever and other signs of illness. You can have it and not know it. But even if you don't show many signs of infection, you can still spread it to others through prolonged close contact. How do you prevent monkeypox virus? A smallpox vaccine provides protection against monkeypox, but its use is currently limited to clinical trials. The best way to help prevent spread the monkeypox virus is to avoid contact with infected animals, especially sick or dead animals. Avoid contact with bedding and other materials contaminated with the virus. Thoroughly cook all foods that contain animal meat or parts. Wash your hands frequently with soap and water. Avoid contact with people who may be infected with the virus. Practice safe sex, including the use of condoms and dental dams. Wear a mask that covers your mouth and nose when around others. Clean and disinfect frequently touched surfaces. Use personal protective equipment, PPE, when caring for people infected with the virus.